Hey everyone, this is the Reinhardt's Rundown, and we're in our tobacco cessation series, specifically talking a lot about nicotine replacement therapies, or NRT. We'll go ahead and start with a question about the NRT warnings, which involve specific conditions where we need to be cautious or maybe even avoid NRT altogether. So the question is it safe to start NRT in anybody and everybody? So pretty much, yes, it is, with a few exceptions perhaps. First, if a patient is having acute angina, really severe arrhythmias, or, is acutely post-MI or, had a heart attack this morning, for example, we probably don't want to be slapping an NRT patch on them without at least getting approval from their cardiologist. Now, immediately after a heart attack, that's also when patients are really motivated to change their health habits, so it can be considered. But again, a physician would need to confirm that the patient is cardiovascularly stable enough to begin therapy. Also, if we have pediatric patients less than 18 or pregnant patients, behavioral therapies would be preferred over something like a nicotine replacement patch. Next video, we're going to talk about what happens if I accidentally break down and have a cigarette while I'm on the nicotine patch. That's the Reinhardt's Rundown. We'll see you next time.